lot of the infrastructure in communities for healthcare is actually funded, developed, and ran by physicians. We're the people on the front lines providing that care, so we know what our patients need.
I'm Dr. Sarah Saunders, and I'm an obstetrician gynecologist here in Whitehorse in the Yukon. I'm one of the co-owners, along with Dr. Emma Sumner, of this clinic, Cranberry Health.
I'm Dr. Catherine Smart. I'm a pediatrician here at Lynx Health, and we've had this beautiful space for the last 2 years.
My name's Rochelle Blay. I'm a family doctor, and I'm one of the founding members of the new Equinox Health and Solstice Maternity Clinic. The new clinic was a need in the community. And in the community, there was not a space for us to move into. There wasn't a turnkey medical clinic ready for anyone to move into. So we quickly realized that it was going to be a project that we had to kind of take on.
I think in an ideal world, there would have been clinic space available for us to walk into. There's a real clinic shortage, particularly here in the north.
Right now, there's not very many places where a physician can come and start a practice. There's just not a space sitting there waiting for anyone.
I think that recruitment is going to suffer for physicians in the north without more clinic space available.
I'm one of the executive members of the new clinic, and so there's a small group of us who spearheaded the project from the entire design process all the way to picking the finishes and the paint colors, and then moving into the space and creating the model of care. I think just having the clinical side really helps you design a space that's going to be super functional, efficient, and pleasant to work in.
The warm colors, the inviting colors, kind of the decor matches the outside and they bring it inside. It has this modern take.
I mean, I think physicians need to be involved in the design of clinics and the build of clinics because we're the ones working in them. Of course, we need input from other allied healthcare providers as well that hopefully would be in that space. The collaborative nature with this nurse practitioner-led clinic, the Yukon Sexual Health Clinic, is really a different model of care here in the Yukon.
So the Yukon Sexual Health Clinic used to be located in a different clinic. And so when they were in the process of creating Cranberry Health, they asked if we would be interested in coming and co-locating with them. It lends itself really nicely to team-based care, quick consults, manage patients in the moment because we are able to run upstairs and talk to Sarah or talk to Emma or talk to Leah. And so we make sure that we are able to support the patient.
I was fortunate enough to see Dr. Saunders at the hospital, and when she moved here, I found that my experience differed quite greatly. At that stage, going to the hospital, as warm as everybody was, it was a place that I didn't want to visit. Versus coming to the new clinic, the colors are more vibrant and natural. The artwork has been selected from across the Yukon. What I really like are the rooms because now I can see out the windows. Just being able to connect with the outside doesn't make me feel so alone.
Patient self-advocacy is huge, and like in a space like this where you feel like it's a safe place to be vulnerable and to bring forward any concerns that you have about your health, that safe space is huge.
The main vision for us for Lynx Health was to really have one-stop shopping for children, youth, and families when it came to their medical care, their mental health, and just the different things they needed to be cared for. We really wanted our team also under one roof because we work in a really collaborative model. So for example, we have a child and adolescent psychiatrist, part of our pediatrics team, so we often share patients. We have a social worker who works as a patient navigator. We have our medical office assistants who really help with all the coordination of care for kids and their families. So in this new space, we're all together, we're all under one roof, we're able to seamlessly share patients, communicate with each other, and really try to create that wraparound experience for children and their families. And that's something that we're able to do much better here in a bigger space that's more purpose-built.
As a group, we felt comfortable taking on the risk of building a new space and putting the amount of work that needed to be done to do that, and also the financial investment in creating new space. I think it's fair to say that There's a lot of physicians who may not be interested in or willing to do that. And I think we need to realize that clinical space, especially in our community here, there's a shortage and we need to develop more space.
There are a few government clinics that have kind of popped up more easily in pre-existing spaces. But if a new family doctor wanted to come tomorrow and join us in Whitehorse, I don't know that they'd have anywhere to work. And that would be a barrier to recruitment.
I think a big part of the clinic design too was being a welcoming place for learners. So for medical students and residents to want to come work here and to feel supported while they're here. We wanted to make sure that any learner that came here had a really great experience, that they felt like they were really welcomed and supported. That aspect is really important for recruitment.
In order to really expand our pool of family doctors, we need more clinic space. Really, I feel like someone needs to build a medical tower. And I think it needs to be a physician. I think it needs physician input to be the right space. But it's a big undertaking.
A lot of times what people don't always realize is a lot of the infrastructure in communities for healthcare is actually funded, developed, and ran by physicians. I think what's great about that is it allows us to be in control of the patient experience, and that's something that we take very seriously. We know kind of what we need the physical space to be like in order to meet the needs of our patients. So I think that physician voice and leadership in creating healthcare is really important. We're the people on the front lines providing that care, so we know what that looks like and what our patients need. When we're able to create those partnerships with government to build out these spaces, I think it really serves patients well.
I love this clinic because I hope it starts more clinics like its kind so that Yukoners have access to healthcare, especially in specialized settings.
I would really love it if other teams of physicians could do the same thing as what's been done here, because it's much more relaxing for us to come to a space that is welcoming. It's not white and it's not institutionalized. It's a place where we can be taken care of.